Hi everyone. It's my pleasure to welcome you all to the session of the HELIConference webinar series. And this time our topic is health of children and young adults during the COVID-19 crisis. My name is Lara van den Borre. I'm the coordinator of the HELICON project. And this webinar series is organized within HELICON. HELICON is a project funded by Belspo, and it's a consortium of partners from Cienzano, UGent, UC Louvain, and the VUB. And we have several research topics related to the COVID-19 crisis, where we try to firstly disentangle social inequalities during the COVID-19 crisis, specifically on COVID-19 infections, hospitalizations, and mortality. Then second, we're also interested in the long-term and mid-term impact of the crisis. So what happens, for example, after COVID-19 hospitalization. And thirdly, our objective is to investigate the indirect impact of the crisis, because we all know that it goes beyond COVID-19. It also has had an impact on, for example, delayed cancer care, the care for acute diseases such as heart attacks, as well as the mental health impact. And throughout our project, we try to focus on using as much administrative data in combination with COVID-related data as possible, to focus on transitions throughout the pandemic, and to focus on the knowledge transfer, so to have our research results have an actual impact for policymakers and the wider audience. Unfortunately, the data we have available and the scope of the project goes beyond. Children are not the focal point, but because we saw that during the pandemic they are a very important and a vulnerable population group, we wanted to also address this issue in a separate HELIConference webinar, so that we all understand what happened during the crisis and how we can learn from these research results in the aftermath of the crisis. So that's why we invited three leading experts to join us here today and present their results on children and young adults during the crisis. So I'm very happy to present the first speaker, who will talk about the gendered impact of social support on children's well-being before and during the COVID-19 pandemic. So I'm happy to present Jasper Dhoore, who is a sociologist and who is my ex-colleague from the VUB. So between 21 and 23, Jasper worked on the Young Research Platform, the YOP platform at the VUB Sociology Department, where he conducted this research. And Jasper is today the coordinator of the Howest Impact Lab, where he's currently also affiliated at Howest. So Jasper, I will give the floor to you.
Can you all see my PowerPoint?
Yes, perfectly.
Yeah. Okay, great. So indeed, I'm Jasper. I currently work at Howest in the west of Flanders, but the research I will present today is from my time at VUB, so the university in Brussels. There I worked at the Youth Research Platform. Research be together with Professor Bram Spruit and Dr. Jessie Sjongers on the gendered impact of social support on children's well-being before and during the COVID-19 pandemic. We also published this information in an article in Child Indicators Research, the sources at the end of this presentation, if you're interested. So the background, where do we start with this research? Well, we started this by observing that a lot of measures to contain the corona pandemic abruptly changed children's daily lives. For instance, we had the closure of public playgrounds at one point in time. We had schools that closed. There was homeschooling. Children had to spend a lot of their time inside. There were the different bubbles and restriction with respect to the number of people children could see and have contact with. So that's all the background for this study. And there were then, based on those abrupt changes, concerns on the impact of all these things and of this lockdown as a whole for children's well-being. For instance, there could be loneliness, boredom, frustration, falling away from their usual routines. There's limited freedom. So that's all can affect children's well-being. So therefore, our first research question was, what is the impact of the corona pandemic on children's life satisfaction? To answer this question, we used data from the International Survey of Children's Well-being. This is the ISQUEP survey. So Flanders participated in this international survey, and we used the data for Flanders. So we selected children from the ages between 9 and 12 years old that go to school in Flanders. And this data, and that is the nice thing to investigate how COVID and the pandemic has changed the well-being of children, is that this data was collected before the pandemic in 2018 and during the coronavirus pandemic. However, I have to note this is longitudinal data with respect to that 2 cross-sectional surveys took place. So one cross-sectional survey in 2018 with people 9 to 12 years old, and one cross-sectional survey with other children, but again, a representative sample of children in Flanders, also 9 to 12 during the coronavirus pandemic. So it's not that we followed the same persons at 2 points in time, but the good thing is that this also means that the ages between both time points are the same. It's both time 9 to 12 years old. And how was life satisfaction measured? We asked, to what extent do you agree with each of these sentences about your life in general? That goes from 0 to 10. I enjoy my life is going well, I have a good life, the things that happen in my life are great, and I am happy with my life. Then we took the average score of these 5 items, and then we have general life satisfaction. So this is a subjective measure, so it's not an objective measure of life satisfaction. It's not that we look at, for instance, cortisol levels or some of those things, but you can think that for children, how they believe they feel, is an important indicator, and actually maybe even the most important indicator. If you feel bad, well, we believe that children then really feel bad. So it's measured identically before and after the corona pandemic, so we could then compare it, and we compare it both for girls and for boys. And what do we see here? If we compare these averages for this measure, that before the pandemic, girls' well-being was higher than during the pandemic, and also with respect to boys, also before the pandemic, it is higher than during the pandemic. So it has decreased. So this means we talk about 2018 and 2021. So during those 2 time points, well-being has decreased for both girls and boys, and we also find that the difference between both, so the amount it decreased is the same. It's not statistically significantly different between girls and boys, so it's actually the same. So we can also look at an alternative way of measuring this. So what can that be? Now we use 2 cross-sectional surveys, but we have not looked at in a person if we look at one person, has that person's life satisfaction decreased? So we can also do that because in the survey, as an extra check, we can do that. We also asked a retrospective assessment of life satisfaction. We asked the children, if you think back to what your life was like before the corona crisis, how happy were you with your life in general? So this is during the corona crisis that we asked them to think back at before the corona pandemic. Then we also again asked during the corona crisis how happy they were, how satisfied they were with their lives. This question is not perfect because with retrospective assessments, there's can always be like a bias of remembrance. Do you still remember how you felt then? But it's just an extra layer of evidence, an extra source of evidence of if it has decreased. So you have to look at this on top of the other evidence based on the two cross-sectional surveys. And again, we see very similar things as the results we see with the two cross-sectional surveys. We see that during COVID, life satisfaction is lower both for girls and boys than before COVID. So it's an extra check, actually. We both find it based on two cross-sectional surveys, and we find it based on a longitudinal question within one survey. Then we had an extra research question. We actually wondered, there exists evidence that social support, so support from people around you, can buffer, can mitigate some of the harmful effects of traumatic life experience and from stressful situations. So this is called the buffering hypothesis. And given that the corona pandemic is a stressful situation, we then asked the question, what is the impact of the corona pandemic on the importance of social support for children's life satisfaction? And we actually expected that social support would become more important during the pandemic, given that it is a stressful situation in which social support becomes even more important than normally. So we asked them on perceived social support. We asked what is their perception on the social support they have from family, teachers, and from friends. For instance, for family, it is, if I have a problem, people in my family will help me. And again, we measured this identically in 2018 and in 2021. And then we were going to look, has this become more important for life satisfaction during the pandemic than before? And what do we see? We both each time look at it for boys and for girls. We see that, for instance, for the nuclear family, it has become more important during the pandemic than before. And this is both for boys and girls. For teacher support, we see that teacher support has become more important for boys, but not for girls. It may be that teacher support is even more important for the ones that need it the most, and that therefore is more important for boys than for girls. And why do I say who need it the most? Actually, research shows that boys often do a bit worse than girls in our education in certain aspects, and therefore it may be that these boys need this social support even more than the girls during the pandemic. And the third thing we find is that support from friends is again more important during the pandemic. So during the pandemic, having friends who support you is even more important for your well-being than before. We find this for boys. We find a borderline significant effect for girls that goes in the same direction. So we have to be careful with the interpretation of this effect. But if we also compared if boys and girls, if this effect significantly differs between both, we do not find evidence for that. So it shows that probably the effect for girls is actually in the same direction as that of boys. So a summary of our findings, and yeah, probably also the most important thing of this presentation. What can we do in the future? Well, actually, we found that well-being decreased during the pandemic. We also found that the importance of social support for well-being increased during the corona pandemic, but this depends on the origin of that social support and of the gender of children, given that teacher support has not become more important for girls. So what I see, there's a Dutch sentence in here. So this is this sentence says, future learnings. What can we learn for this? Well, we need attention for the well-being of children during these crises. Hopefully we never have one in the future, but if there is, we need attention to the well-being of children. And we should really, if we want to change something, we should really focus on a support network around children to minimize the impact of well-being. And focusing on a support network that starts now. We do not have to wait until a crisis happens again. Now we should really focus on supporting children, making sure they have friends around them, that teachers support them, that their family supports them. So this is the source of this presentation. It is published in Child Research Indicators. And if you have any questions, I am happy to answer them.
Thanks a lot, Jasper, for your very interesting presentation. So we have time for maybe one question or maximum 2 questions. So feel free to ask also your question in the chat. So are there any questions?
Yeah, I have a question for Jasper, Steven van Gucht here. Thank you for this very clear presentation and data. And I was wondering, if you look at the drop in well-being of the children, of course, in the numbers, you see there's a drop, but how... I thought it was still, I would have expected worse. I would have thought it would have dropped lower. Can you interpret this? Is this very drastic drop, or is this still, I'm missing a bit of a qualitative judgment in this.
Yeah, I understand. I'm going to go back in my presentation a bit. Yeah. So actually, the drop, may not be that big. If you look at the absolute numbers, for instance, 6.6 during COVID for girls is still 66%. But if you compare it with what it was before, if normally they feel they are like an 8 on 10, then actually going to less than a 7 may be for children a significant lowering, because that's 1.5 points. That's like 17% lowering. That's still a significant drop, but it's indeed still not the case that they go below a 5 on 10, for instance. So indeed, it's not it's not that they suddenly feel horrible.
Because it were exceptional times, of course. This was definitely also for children a very exceptional crisis. I think this was done on, I think, May, June 2021. Probably it would have been different maybe if it would have been during the first wave or something. I think the scores would probably be lower, or maybe not lower, because they're with their parents all the time. I'm not sure, but it's already in a well-advanced stage of the pandemic also. I think it fluctuated even strongly within.
I think indeed also your comment on the qualitative information that is needed. I think that's indeed a recommendation for research, is to really look into this in a qualitative way and really go in depth on what does this lowering in well-being mean, because this is general life satisfaction. So actually children choose themselves what they take into that assessment of life satisfaction. So yeah, their friends and social contacts are part of that, and being isolated, but also a lot of other things are also taken into account there. So it would be really interesting to see, yeah, what also plays a role there, and what weight do they give the things because that are happening because of the pandemic compared to other things that may not have changed because of the pandemic. So that's also that would be a really interesting course of research.
Thank you.
Thank you, Jasper. So please feel free to use the chat if you have more questions.
Yeah.
So now we are pleased to listen to the presentation of Simone Marchini. Dr. Simone Marchini is child and adolescent psychiatric at the Hospital Universitaire of Brussels. He is currently doing a PhD at the Faculty of Medicine at the Brussels University, and his primary focus is on youth mental health, particularly in the prevention and early intervention of emerging psychiatric disorders in adolescents and young adults. So I will give the floor to you, Simone. Maybe you can share your share your screen.
Yeah, thank you, Lisa, very much. Thank you, HELICON, for organizing this cycle of conference, and thank you for inviting me. I hope you can.
But we can't see your slide.
You can't. Okay, wait.
We see the meeting.
Can you see now?
No, it's still the WebEx. The WebEx meeting.
Okay. So I will just start back again. I'm sorry. Okay. Here, can you see now my presentation?
Yes, and it's still full screen. Perfect. Thank you.
Okay, perfect. Sorry. So this I would like to hide it. Okay. So thank you for the nice introduction and invitation. I would not further introduce myself because you already presented a lot. I will introduce and present the results of one study that we dealt within our research team of child psychiatry and psychology at the University Hospital. We were interested in gathering data and find the relationship within child and adolescent mental health outcome and their parents during the COVID pandemic. About the background, I think we all are aware that, well, lockdowns and restriction were really impacting mental health in both adolescent and children, and also their parents, the adults. You can see that there are a lot of a huge amount of data about English speaking countries. We were a little bit worried that we wouldn't be able to picture properly the situation in Belgium. So that's why we started a study on Belgium specific data to fill the gap about potential data limited. And we wanted, as I said at the beginning, to mainly focus on the emotional well-being and mental health symptoms to guide also policy and interventions, especially in our field of child psychiatry. We were quite worried about the short-term and also the medium and long-term effects on the COVID pandemic on the children mental health and development. So we wanted to both assess children, adolescents, and their parents during the pandemic. We would have liked to compare outcomes between the first and second wave of restrictions. There was a question for Jasper before about the chronology impact, and I will try to, with the results, you will see that we tried in our cross-sectional design to keep in mind that the periods were not impacting at the same entity. And we wanted also to picture the risk factors specifically for depressive and anxiety symptoms that we know that they are the most frequent one within the general population. And we also published our results in 2022. I put here the reference if you want to check for our results and comments. So as I was saying, we dealt a cross-sectional study, and we used the DAS scale for parents. It's a scale validated in French for depression, anxiety, and stress. For adults, it's 21 items, whereas for children, we use the multi-score depression inventory for children that is assessing both depressive and anxiety symptoms. So they were self-assessing children and adolescents their own depressive and anxiety symptoms, and we double-checked with the CBCL, so the child behavior list. Based on behavior, parents were assessing their observation on their own children and adolescents, and we were describing internalizing and externalizing symptoms. We conducted an online survey in Belgium. The period was between 2020 and 2021, so at the very early stage of the pandemic, after the first lockdown. We needed some time to put all in, build the study, the procedures, and so we were not leading this study before. We just started with the start of the pandemic, and we spread quite widely the survey, and we use also the snowballing effect. And we finally recruited 273 children. They were aged from 7 to 17 years old, and 218 parents. The reason why the sample are not equally corresponding is because we asked if parents were having several children, several siblings in the family hold, they could answer several times for the children differently. And so if we go back to the chronology of the pandemic, you might remember that after the first lockdown in March, from March to May 2020, there has been a summer period where we have a break of the restrictive measures, but then when children got back to school in September, we started to have some additional measures, and we identified the 2nd of November as the start of the second lockdown. I know that it was not like a full lockdown as the one in early spring 2020, but we based our division on the first period of the data collection and the second one based on the school system mainly. Because of the social exposure for children and adolescents, they were really affected about the hybrid system of both secondary and then primary school attending in a hybrid system. And so we will have the comparison between first period, it will be this summer holiday, somehow free from restriction, and then the second one, P2, it will be in the second lockdown. If we go a look in the social demographics of our sample, we will see that we have nice distribution of age of children, also male and female, and also nice distribution of age of parents. And we also have half of the sample living in town and half in the countryside, and mainly of them, the parents, they were in couple. And also accordingly to the socioeconomic status, it was quite diverse. If we take a look on the parents' symptoms, comparing from P1, so the first period during summer 2020 and the second period, you will see that according to stress, when the blue area of the pie chart is decreasing, it means that there were less people feeling abnormal stress symptoms. So you can see that from mild to severe, stress symptoms were increasing during the 2020 and 21 period. Same pattern for anxiety. You can see that the normal results of anxious normal anxiety were highly decreasing from P1 to P2. And the most astonishing results were on depressive symptoms, where here we can see that actually 50% of parents were passing from normal to moderate to severe depressive symptoms during the second lockdown. Concerning children and adolescents, we can see that from P1 to P2, there is the same, almost similar pattern as their parents. The normal portion of children experiencing depressive symptoms is highly decreasing. And we can see also that the frequency of depressive symptoms is very, very high, because if we take a look on severe depressive symptoms, in our sample it was around 4%, whereas we know that severe depressive symptoms in the general population are mainly around 0.6%. So it's extremely high during both before and second and after second lockdown. And also we can see that adolescents, they were showing higher rates of depressive symptoms compared to younger children. If we take a look on the CBCL results, we can see that internalized symptoms were increasing from P1 to P2. And when we're talking about internalizing symptoms, we are talking about anxious and depressive symptoms, introversion, and somatic complaints. Whereas externalized symptoms, so aggressive behavior, conduct disturbances, they were quite stable, but still quite frequent. And if you take a look on the correlation between child and adolescent and their parents' symptoms, then we can see that depressive symptoms for children were significantly positively correlated with scores of DAS, so both stress, anxiety, and depression. And if we adjusted on socio-educative level of parents and the financial impact and origins, the use of psychotropic medication by parents were increasing on a 4-time-fold the risk for children to develop severe depressive symptoms, and also the depressive symptom scores on parents were a risk factor for children and adolescents to develop depressive symptoms. And it was associated with, as I was saying, moderate to severe levels of depression in children and adolescents. So for our discussion, in general, the whole sample of children, the severe depressive symptom was really high rate, and adolescents were showing a great rate of depression. Especially we can take on developmental stage of individuation, and it was particularly challenging the social restriction they were exposed to. And if we compare our child and adolescent sample between P1 and P2, we see that the depressive symptoms were not shown by before less than half of the sample, and the mild to moderate depressive symptoms were increasing, whereas the severe symptoms were quite stable. In general, we can conclude on a general deterioration in depressive symptoms. And about parents, 50% were concerned about moderate to severe depressive symptoms during the second lockdown, and we've seen a double fold increase in depressive symptoms. And there was a high correlation between the parental scores of depression and their children. And so parental psychotropic drug use and depression were a risk factor also for children and adolescents to develop psychiatric depressive symptoms. The limitation to take into account about our study is the cross-sectional design. Of course, we cannot conclude on a causality based on that design. The period of data collection was quite long, so we cannot tackle directly which period was mainly challenging for children and adolescents and the parents. And of course, the online questionnaire leads some selection bias about people not having access to internet or not reaching the information, and also about our generalizability in the general population. About the recommendation to conclude, of course, we know that the pandemic significantly impacted mental health in Belgium. there was a worsening depressive symptoms for both parents and children, and we can learn some lesson about the future public health crisis management. We would like to stress and highlight the attention on managing intervention on both children and parents. I'm very glad that HELICON is focusing also on children and adolescents. We know that they are mainly they were not that much considered, but I think that we are a rising awareness about the attention we have to address to their mental health too. We would like to stress also about the importance of holistic intervention on families, but also on school-based mental health programs, because the hybrid and the distant way of attending school, it was really decreasing the support that children could benefit from. And I would like to thank also the whole team, because I'm here presenting, but I was not alone leading the research. Of course, many thanks to the participants and the Fondation Universitaire team that helped us for the publication. And thank you very much. I'm available for any question if you have.
Thanks, Simone, for this very interesting presentation. So are there any questions?
Yeah, it's Steven again. I just have a comment. When you compare the two periods for anxiety and depression, I think it's important that the difference between both periods, it's not only the measures, where the first time we had a quite strict lockdown, later on it was a little bit more balanced. But of course, in the first wave, there was also a huge amount of uncertainty and anxiety in the population, not necessarily because of the measures, but because of the virus, this unknown virus. Whereas when you compare that with the second period, people knew what it was. They had seen the symptoms, which for a lot of people were relatively mild. There was a perspective of a vaccine. So you also should take that into account. I don't think it's only the measures that will determine the mental status of people. It was also, I think, the natural history, so to say, of this pandemic, with incredible amount of uncertainty in that first period. That's just a comment.
Yeah, of course. Thank you, Steven, for pointing out. It was part of, I went through quite fast in the limitation because I was a little bit late, but of course it was one of the main limitation of our study. Maybe the one thing that I could comment additionally is that our first period was not the first lockdown. It was during summer 2020, yep. I'm sorry. So still, I agree with you. And of course, it's part of, I mean, we know when we launch studies, they are never perfect as we wish, but there are some limitations we have to take into account. But at least we can compare on summer 2020 that was quite restriction-free, and we thought at one point that a pandemic was done, was over. If you remind it, during summer 2020, we were believing that it was behind us. So still, there is a quite interesting effect we can see by time.
Yep. Okay, thank you.
Thank you.
Laura, do you have...
Yeah, if there is still time, I would like to ask Simone, first of all, thanks for pointing out the importance of a holistic view on families, and that a disease does not impact the individual alone. Of course, it's the wider environment that is also impacted. But I was wondering, practically, do you have any examples of such a holistic view on how we can support individuals and their families in terms of mental health?
Well, of course, it depends on at which level we would like to intervene. For us, since we are the university hospital and the child and adolescent psychiatric department, what we say when we collaborate with the psychiatric department, for example, we say don't see your patients suffering from anxiety and depressive as alone individuals. If they are parents, then you should take that into consideration. If we take the input from the adults, then we need to go down to the family dynamics. If we are talking about more general population intervention, for example, or next crisis, even if we cross fingers that would never happen again. I think that what is really important, I'm not a specialist myself because I'm a psychiatrist, but I think what is really important is that we raise the awareness that we cannot just focus on parents or children and adolescents. We need to increase the communication and the support they could provide reciprocally. And that's one of the main things that we could target.
Thank you.
Thank you.
Thank you, Simone, for your presentation. So now we are pleased to listen to the presentation of Lisa Fomenko. So Lisa Fomenko works as a researcher at the International Center of Reproductive Health at Ghent University, where she focuses on topics such as intrafamilial violence, sexual aggressive behavior, and sexual and reproductive health and rights. Her work emphasizes the impact of this theme on mental health and focuses on the trauma-sensitive and holistic approach. So I will give the first to you, Lisa, and thank you.
Yes, thank you very much. I will try to be quick into sharing my screen. Share. Up. It's loading. Can you confirm that you can see only one screen?
It works. Perfect.
Yeah. I don't know why you skipped the first slide. Okay. So thank you very much for inviting me. Thanks a lot to my colleagues from other institutions and universities, Jasper and Simone, for the presentations you gave before, because I will be able to get back to it sometimes. For those that are interested in the article, because I will skip or go more quickly through the methodology, and if you want to have all the details about that, then please scan the QR code. If you aren't quick enough, it comes back at the end of the presentation. And for those that want the file, I can still put it in the chat as well after the presentation. Now, we were working on this study with quite a big team, so not only from ICRH of the University of Ghent, but also criminologists from the IRCP. So the names you can see here with Lotte de Schrijver, Christophe van de Vever, and Professor Ines Keijnaert. And this study was actually completely, it wasn't planned, it wasn't coming from a call, it wasn't from a data set that already existed. It was simply researchers that came together at some point during those very stressful COVID-19 times and who wanted to have a study to measure the mental health consequences, but also the consequences on domestic violence. So, because we talked a lot about mental health, domestic violence didn't come into the discussion just yet. So I simply want to start by the definition that we use. What do we understand about domestic violence? It's any behavior in the family or domestic context causing physical, psychological, sexual, socioeconomic suffering to someone else. And that someone else, it's not simply the partners, the intimate partners or the ex-partners. It also includes children, siblings between themselves, and elder abuse. And what is so problematic about the domestic violence? Well, of course, it's the violence itself, but it's mostly also all the negative consequences that continue after the occurrence of violence. So we are thinking about physical consequences, psychological, sexual, social, economical, and not only on the individual, but rather on their whole family and even the community around it. So many quite bad consequences, which we will get into shortly. So what's the problem with the COVID-19 pandemic and violence is that one of the huge risk factors is stress. And like Jasper said before, COVID and the measurements and also what Steven said, the unknown factors of the disease all of this fueled a lot of feelings of stress, anxiety, frustration, and that's the ideal ingredients to make a pot that is boiling go over and everything comes out and violence happens. And so during the COVID-19 times, especially those first lockdown weeks, there were a lot of reports of further escalation of already existing violence. So families that already struggled with this, but it escalated even further. But there was also more and more households that reported violence where there wasn't any violence before. And for example, one of these reports came from hotlines. For example, children that were chatting during the first lockdowns with existing helplines, and who said, we are very afraid to come back home because, well, we are afraid of being at home. We need to be able to escape. And Jasper said before how important that parental support can be in the mental health constructs. Well, for some children, they cannot count on the family. So what we would love to believe as the home being the safe haven, it isn't the case for everyone. For some children, it will be the schools, but they couldn't go to the schools at some point. For some people, it will be the friends, but they couldn't get to their friends at some point. And so they were locked up at home in a construct that isn't as safe as we would want to for every child. So in the study, there is a lot on this slide because it was a study that didn't actually want to focus on children at first, but we saw that we had so many households with children that we decided to derive a bit into that theme. But so the inclusion criteria were very simple. Living in Belgium was the most important one because every country has their own measures, every country had their own waves. Being older than 16 years or being 16, and the data collection took place in 2021. So the time periods that were asked were retrospective. So of course there is some memory bias. Other studies were running at the same time during the lockdowns. We were able to confirm the findings here. I will not discuss the limitations of this study in detail. You can find all of it in the article. But we had a very big sample size. A lot of people started the questionnaire. In the end, we were very strict. We only kept those that came at least to one question concerning violence, which led us to the total sample of 2,911 participants. And the survey was quite big with a lot of socio-demographic aspects that were asked, relationship, social context, stress and mental well-being, and negative experience, which are the psychological violence, physical and sexual violence. For the study here that we did, we only looked at what they said, what they reported before the first wave, so before the COVID really started, before the first lockdown, and then the difference with the first wave. Here, exposure to violence, we didn't ask people if they were abused because we know by experience that most people don't identify what happens to them as abuse. Some do, but a lot of people don't. So we asked very direct questions. Did someone try to stab, burn, mutilate, or strangle or kill you, for example? It's a direct action, and we see that then people indicate that as yes, but still might not see it as abuse. So they were very quite detailed and hard questions in this questionnaire. And for each of these actions, we asked to whom did this happen and who was it that did this. The data analysis plan, we had a lot that we looked into. We have the descriptive statistics. I will not go through all of them, but we have the group differences where we looked into the difference between households that reported no child abuse versus households that did report child abuse. But most interestingly, we looked into binary logistic regression, to see if there is any kind of relationship between our predictors and child abuse as an outcome. And the predictors, we will dive into it like immediately. So for this sub-study on households with children, we had 870 respondents who had at least one child, and all children, if more than one, were under 18 years, because we wanted to have only those households that lived together with their children. And we weren't able to catch for the older children who lived somewhere else, maybe already on their own in a studio, or coming back home sometimes, or not coming back home. So that's why we took only children that still went to school. We had a sample which was mostly female, 81% finished higher education. The mean age was 40 years, and then we had a lot of different households, with some where there were only 2, some with 3, and some with more than 3. But what was most alarming in our data set was the mental health status of the respondents, and so the parents in those households. And I think it confirms what my colleague said already previously, but here are still some extra numbers. 21% had acute stress symptoms that were present, 78% with moderate to high perceived stress, 1/3 moderate to severe psychological distress, half of the population with problematic alcohol intake, and 17% with suicidal thoughts. So when we talk about coping and stress, I think the numbers are quite clear that it came out in all kinds of forms. And when we looked at the age of the respondents' children, we had a lot of children that were 0 to 5 years, but the bigger group was 6 to 12 years old children. For the violence, 1/3 of the respondents were directly exposed to domestic violence. That means that they were a victim themselves. And then 15% of the respondents reported at least one child that was victimized in their household. And 15% might seem like a percentage to some, but if we take a class of 20 children, that means that 3 of those 20 children were abused during the first wave. So here you can see in the plot also a division in the violence. So for the respondents and the children, it was mostly psychological violence. Then we also had physical violence, and for the parents, we've also found sexual violence. For the children, we only had one where they reported sexual violence, so the percentage remained at 0. The assailants were mostly the respondents themselves, with 28%, or their partner. So for most, that will be the other parent of the child. Only 48% reported that the assailant was not part of the family. And when we look at the gender of the assailants, I think some might also be surprised here. 63% were male and 45% were female, where for psychological violence, we see that females tend to report that more, and physical violence is more prevalent with a male assailant. Now, when we looked at the association of what could potentially explain or relate to the child abuse, surprisingly, we found that households with very small children, with at least one child between the age of 0 to 5, they reported they had a smaller risk of child abuse in the family, in the household. We don't have an explanation for that, so maybe some other people here have some interesting hypothesis. But we found, for example, for the household size, that the risk gets larger, higher for larger households, starting from 4 members and getting even higher for 5 members. Then for the perceived stress, respondents that reported higher perceived stress levels also had 2.5 higher risk to have child abuse in the households. And then the two last ones are very interesting because respondents that were victims of violence before the pandemic, that could be, for example, in their own childhood, that could be 1 year before the lockdown with the same partner as they are now, that could have been anything. But once they were victim before the pandemic, there was 3.5 higher risk of child abuse. And respondents that were victims during the pandemic, and for their children, it was 1.7 increased risk of child abuse. So that comes back in our conclusions. First, we see clearly that increased stress leads to more domestic violence, which means that extra efforts should be made to improve the well-being during sanitary measures, where sometimes there wasn't as much time or resources to look into that more. But we see that it's really important because those and the domestic violence and the mental health, the well-being, it's all long-term effects that you don't just, when COVID-19 stops or when the pandemic is dying down, that everything is being well again. It's very long-lasting negative consequences, so they shouldn't just be ignored. But what we also see, and we already knew that, but now it just became a bit of a bigger problem, that there is clustering of violence within households. So we see, for example, victims that re-victimize multiple times in their lifetime, but we also see that their children, their offspring also has that vulnerability towards violence and being a victim. So really a clustering of violence within families, where it's very difficult to say who is a victim, who is an assailant, as a lot of the times they are both at the same time. So key actions to fight this, because it's not that we are all living with psychopaths, it's just that life can be very stressful sometimes, and then sometimes that the kettle explodes, leading to the violence. At the time the assailants don't want that to happen as well. But some key actions to fight this is to train healthcare workers, as they are the ideal person to screen and assess risk of violence and to tackle it, to do something about it, to follow up, to refer, and to help the people at risk. But not only in the setting of healthcare workers, but also in schools. Like we said before, for some children, the home isn't a safe haven, and maybe some will have more difficulty to get to a healthcare provider, but schools, normally in Belgium, children should go to school, and schools can be a very good safety net for children to also help in the screening and assessing potential risks of domestic violence. But also another important key action, and I think I'm completely following my colleague Simone, that interventions shouldn't only focus on the individual that reports stress, abuse, bad mental health, but to really include the children, or simply look at the family as a whole, as it's most of the time not an individual problem, but really dynamics playing in that family. And you cannot find a solution for one person if you don't target that complete dynamic. So we are already at the end of my slides. I hope it didn't feel too rushed. If you want all the details, you can find the QR here again. For the first action point that I talked about healthcare providers, we already started some intervention on that. So everyone working in a hospital, eager to help, eager to detect signs of domestic violence, wanting to know how to refer, how to act, how to communicate, please visit our websites, operatiealert.be for the Dutch speakers and operationalert.be for the French speakers, as we have many nice e-learnings for you there. And that's it. Thank you for listening.
Thanks a lot, Lisa, for this very interesting presentation. I suggest to ask the question directly in the chat, and so we can directly welcome Caroline Vreyens, who has been the Flemish Commissioner for Children's Rights since the 1st August 2019 for the closing remarks. So I will give the floor to Caroline Vreyens.
Okay. Thank you very much. You understand me well? Good morning. Hello. Can you understand me? Okay.
Yes,
I
we
see
can.
people nodding.
Perfect.
Okay, perfect. Thank you so much. Just wanted to check. Thank you very much for the invitation for a short closing remark. We all know that the corona crisis affected all children and young people and also really challenged children's rights. Today we know this very well. Thank you all for your important work and for the presentations today and for the HELICON projects. I cannot agree more with the conclusions and recommendations of the last speaker on what is important to tackle violence and abuse and children being a victim of this. In all the research projects presented today, we can see that there really was a severe impact on children and young people's well-being and on violence and abuse. With social support, detection and training of professionals around children in schools or elsewhere being really important to tackle those problems effectively. We believe that those are important lessons for the present and also for the future. It's true that the perspective of children and young people, that's really our conviction, was not giving enough attention during the pandemic. Not only we missed their voice, but also there was a lack of attention to the impact of the crisis on their rights. Consider the right of education, the right to play, the right to shelter and asylum for certain children in a vulnerable position, the right to assistance, youth care, and to protection against violence. This is why we organized, together with the Children's Rights Knowledge Center and the Children's Rights Coalition, a large survey in 2020 among children and young people in Flanders, because we know there was a huge impact and we really missed their voice and the impact on their rights. Our goal with the survey was, of course, to give more space in the corona measures and in the exit strategy to their well-being and their rights, and to learn lessons for the future. We conducted an online survey. I want to take the opportunity today to explain this very briefly. We conducted a survey among 8 to 17 years old about their experience and needs in time of corona. The moment we launched the survey, this was in May 2020, we had a huge reaction on it, and we also had parents saying that their younger child, younger than 8, wanted to participate, and that students until the age of 25 absolutely wanted to participate in the survey. So we of course accepted this. The survey ran from May 11th to Sunday, May the 17th in 2020, and children and young people made themselves heard en masse, I can say, and more than 44,000 surveys were completed. The results show how children and young people experienced the crisis and the approach and what their needs were. And for us, this had also really had to feed political decisions that were made at the time on opening playgrounds, on opening schools and youth care facilities. We saw in the survey, in the research, that the corona measures were clear for most children, but that the information on the rules and the measures were less clear for young people, so a little bit older than 12 years. We asked for clear and direct information to the authorities for young people and children. And the survey also showed that 1 in 3 children were afraid of getting sick themselves, and 2 in 3 children were afraid for their family and friends. This showed for us, once again, the importance of correct information to reduce fear and panic. And fear and panic, of course, we know this can hugely impact mental well-being and well-being in general of children and young people. The Corona guidelines, of course, also had an impact on the emotions and well-being of children and young people. We saw it in the survey, with boredom and loneliness being much more there than before the crisis. Children and young people told us that they missed a lot during the period, most of all their friends, their family and free time. And this is why we also asked that the school, youth work, youth care and the CLB in the schools continued to connect with children and young people at the time. This is what we asked, of course. Children and young people needed perspective also for the summer, and we asked for more attention for their needs in the rules and the Corona policy in general. The impact of the guidelines was enormous, especially if children and young people grew up in a difficult situation with, for instance, little space at home, not a lot of possibility to go outside in a private space, not living with their parents but in an institution, or living in a situation with stress and violence in the home or in the institution. We saw in the survey and in the response we received that this really confirmed this hypothesis that it was much more difficult for children in a vulnerable situation. Just very briefly, a little bit more on the results. The results confirmed the signals from care providers we received that there was more domestic violence due to the lockdown. 1 in 2 children and young people said there were more arguments at home, and 1 in 10 children and young people sometimes experienced physical and verbal violence, and the majority of those children said that violence had become more common since COVID. Since the Corona measures, there have been more risk factors for violence in families, as the last study presented today also shows, such as stress, fear, financial insecurity, and constantly being on each other's lips were factors in our survey. We saw this, that of course affected also this violence in the home. At the same time, protective factors disappeared, such as social contacts, social control, youth care for the family, places to find supports, for instance, in the school. Those are protective factors that, well, disappeared or were less present, of course, during the measures. We asked policymakers that the lockdown be combined with the protection of children and young people against violence, and that there was really a need of awareness about abuse and violence and comprehensive information on emergency helplines for the broad public. For families experiencing difficulties, youth care had to remain available and accessible, especially during the period of lockdown, but also after the COVID pandemic. It had to be really much more accessible and available. Opening schools and playgrounds where children and young people could escape from the difficult home situation could also help very much, and we lobbied a lot for this, and there had to be opportunities for them to find the support in daily life. Furthermore, we asked for intensive attention to the child reflex being well known in first-line organizations such as CAW's, OCMW's, and with general practitioners, huisartsen, teachers, youth welfare work, and after-school childcare. So training, of course, is also very important. We learned that there was, of course, a huge impact on the ability to learn and the right to education for children, especially for them growing up in vulnerable situations. We also learned certain things about the right to play. Half of the children played with their brothers and sisters, but 1 in 5 had no brothers and sisters in the home and had to play alone for weeks or for months. Among young people, the majority of young people saw their friends online, but in addition, 1 in 2 young people saw their friends in real life, but with the necessary distance. For young children, teenagers, and young people, the right to social contact with others and the right to play and relax is, of course, crucial, especially in an age phase in their life where they take a little bit more distance of their family and their home and try to mingle with their peers. But of course, the Corona measures severely limited those rights. The figures in our survey and research showed that some children and young people spent a lot of time indoors, and that socially vulnerable children, again, were the least likely to go outside and relax. We asked the various authorities at the time to to communicate clearly to young people about what is and what is not allowed outside, I deal with clear pictograms in places where children and young people came together and play, such as happened in the Netherlands. To open also more public spaces to enable remote play and meeting, and we asked the authorities to be more ambitious and to do more than just make spaces and playgrounds accessible again to many vulnerable children. Many vulnerable children really were indoors for a too long period during the pandemic. Finally, the survey also assessed whether children and young people had a voice in how to deal with the corona guidelines in home or in the facility where they lived. We saw that 1 in 5 was not allowed to have a say in those rules, and for young people this was 1 in 4. For young people living in a group facility, this was even more than the half of them. So more than half said that they were not allowed to have a say in this or to really talk about it in depth. Given the major impact of the crisis, it is important to hear children and young people clearly about what is difficult for them and what can or should be done differently. So literally involve them in their agreements at home, in the facility, or in the emergency care at school. And for us, also involve them on a policy level and listen to their voice. That was a lesson for us, happened really not enough in the COVID pandemic in a whole, from the beginning until the end. After the survey in 2020, we did a lot of lobbying and advocacy during the whole pandemic to defend the rights and well-being of children and young people. I also personally felt really responsible because of my mandate for this. And I tried to do school visits when it was possible and walks with young people to speak to them personally. What I learned is that a lot of young people felt lonely, that sometimes there was a kind of resignation, and some of them seemed to give up to try to meet friends physically, which I found profoundly worrying. And I also learned from those talks that schools and teachers that chose to make the COVID pandemic, the rules and their thoughts and feelings about it a topic, sometimes in the classroom, was really very helpful for young people. Just to be able to share their feelings and thoughts about it was helpful. I'm also a member of the Bureau of ENOC. ENOC is a European network of ombudspersons for children and young people. I'm in the Bureau for years now, and we did a research in Europe on the impact of the pandemic on children and young people. And we saw how big the impact was on their well-being, the demand, the need for mental health care, and the impact on their rights was really huge, of course. Conclusion, also today we know that for children and young people, mental well-being is a very important topic, really a priority for them. We see it when we talk to children or on our Children's Rights Day in the Flemish Parliament. We also know this from the Flemish Youth Council, that this is a priority. This week, our federal government decided to cut in the subsidies 3 million euros in projects for the mental well-being for young people. And since the last couple of days, 2,500 experts, academics, and people working in the field signed an important petition asking to reverse this decision that could heavily impact children and young people and the support they receive. So just to say that your projects and your research is very important still today, and that we are, of course, very worried about the mental health of children and young people, and that we need really an investment and prevention, an investment of the government in the mental health of our young people. Thank you very much for all your work. Thank you.
Well, thank you very much, Caroline, for these insights. I completely agree with you. And this brings us to the end of our webinar today. I would like to thank all of the speakers for their thought-provoking presentations and all of your insights into how we can take these lessons from the COVID-19 pandemic at heart and improve health and well-being for children and young adults in Belgium in the future. So practically, the slides and the recording of this webinar will become available on our website starting from tomorrow. And as a scoop also, the next HELIConference webinar will be organized around the topic of cardiovascular diseases. and how the crisis had an impact on delayed care and how we can avoid similar impacts in the future. So in a couple of months, we will have another HELIConference webinar on this. Thanks everyone for joining us today, and I wish you all a good afternoon and a good lunch today. Thank you.
Thank you very much.
Thank
Bye
you.
bye. Thank you.
Bye.
Thank you. Bye.
Thank you.